Good day, everyone. So my name is Mohamed Zahran. I work as Associate Professor of Cardiology at Ain Shams University. I'm currently the President of the Continuous Medical Education Working Group at the Egyptian Society of Cardiology. So we will be discussing about a few points to remember in the valvular heart disease patients. As we all know, the valvular heart disease patients are divided to left-sided mitral and aortic valvular disease and right-sided tricuspid and pulmonary. Planning the management of any valvular lesion depends upon the decision regarding the severity of the patient's lesion by echocardiography or cardiac MRI if available, and number two is the symptoms of the patient and his quality of life. So the left-sided valvular lesions are more common than the right-sided ones. You should know that medical therapy is usually the gold standard for isolated valvular lesion, except those that are graded severe by echocardiography or cardiac MRI. The severe and symptomatic valvular lesions are those indicated for valve repair or valve replacement, whether by surgery or by intervention. First of all, mitral stenosis. In Egypt, it's mostly of rheumatic etiology. Do not forget the long-acting penicillin for prophylaxis as indicated. Avoid excessive salt intake. Mainly, the symptoms will appear if the mitral valve area is below 1.5 centimeter squares. Beta blockers control the heart rate. Diuretics control the dyspnea, which is caused by the elevated left atrial pressure and pulmonary venous congestion. And usually, mitral valve area below 1.2 centimeter square and the presence of symptoms favor intervention in the form of balloon mitral valvuloplasty or surgery according to the anatomical criteria. Second is mitral regurgitation. Mild and moderate mitral regurgitation are usually very well tolerated. The severe mitral regurgitation needs echo follow-up every 3 months, looking for the left ventricular dilatation, especially the end systolic diameter, and the left ventricular impairment of the ejection fraction. Atrial fibrillation worsens the mitral regurgitation symptoms. Salt and water retention need to be tailored per patient according to the patient's fluid status and matched with the diuretic dose if needed. Beta blockers and diuretics control the symptoms. Vasodilators according to the systemic arterial pressure also ameliorate by reducing the preload and the afterload. Regarding aortic stenosis, moderate cases of aortic stenosis are followed up every 6 months by echo. Severe and symptomatic aortic stenosis is an indication for surgery. Severe but asymptomatic aortic stenosis needs very close follow-up for possibility of surgery. Vasodilators are absolutely contraindicated and statins have no role now. Proper hydration is needed to avoid hypotension and fluid loss. Syncope is a very serious and grave sign. Regarding aortic regurgitation, usually the left ventricle can tolerate severe regurgitation until it starts to dilate. Do not forget to scan the aortic root for pathology that may involve the aortic valve and may be the cause of the aortic regurgitation. The vasodilators can control the symptoms so long as the blood pressure allows. Avoid beta blockers. Diuretics can cause severe hypotension. They should be avoided. Surgery is better to be done once indicated, which is meant by severe aortic regurgitation associated with left ventricular dilatation. Regarding right-sided valvular lesions, as we all know that the organic tricuspid stenosis and the organic pulmonary stenosis are very rare, organic right-sided valvular stenosis raises the suspicion about a primary gut tumor like carcinoid syndrome. Tricuspid regurgitation is usually secondary to right ventricular dilatation, which happens in cases of left-sided heart failure or left-sided valvular lesions or cor pulmonale. Treatment is usually in the severe valvular lesions and is directed towards treating the primary cause. The medical treatment includes diuretics and reducing the salt and water intake in cases of systemic venous congestion manifestations like ascites and lower limb edema. Surgical treatment is usually in the form of valvular repair rather than valve replacement. Thank you.